Hello and welcome back to another episode of Ask a Nac Doc. I'm Jeff Patterson, Chief Executive Officer for Nacogdoches Medical Center, and today I'm here with Dr. Chris Klingenberg, Assistant Director of our Emergency Department. Welcome.
Thank you.
Dr. Klingenberg, can you tell us more about you and your family?
Yes, I have a beautiful wife named Jennifer and two great kids. My oldest son is Grayson. He's graduating high school this year from Nacogdoches High School. Very proud of him. And then my younger son, Joey, is at McMichael Middle School. He is 13 and in the 7th grade.
In addition to having a busy family life, I know you do some things outside of the emergency department with local law enforcement as well as Stop the Bleed. Can you expand more upon those activities?
Yes, sir. Yeah, I support the local police department heavily. I work and train with the SWAT team. The bigger thing that we do is basically train all of our local law enforcement, Stop the Bleed, but more importantly, like the TECC interventional medical paradigm. So what that is basically is the premier medical stabilization package that you would use anywhere in the world for any person. And so we have gone through methodically and trained everybody in law enforcement in Nacogdoches County. And we're going to be continuing that training this spring and then into the fall and for the next several years. We have a 4-cycle training package for them. And when we're done with this complete training package, they're going to be as trained as any military or special operations person anywhere in the world. Our local LE community, that's our goal.
That's amazing. And I've gotten such tremendous feedback from the folks that have participated in that training. We cannot thank you enough for your efforts on that front.
Oh, you're welcome. Yeah, it's my pleasure. I enjoy it immensely. And so it's a passion for me. But what's really cool is seeing the police officers save lives on the street. So since we've started this, we've had at least a dozen legit saves by law enforcement officers of patients prior to anybody else coming on scene. So tourniquets, junctional wound control, all that. So the work we're doing is actually saving lives on the street. And seeing the officers being able to do that and then understand the power of that is really special for me.
Well, I concur. I hadn't thought about that, saving lives in the hospital and saving lives on the street. Thank you so much.
You're welcome.
Under your leadership over the last 8 years, we've been able to achieve certain certifications in chest pain, being a primary stroke center for the hospital, level 4 trauma designation. Can you tell me why those are important and what they bring to our community and healthcare?
Yes, sir, absolutely. So the designation itself is important, but what's really important is the system that designation creates, right? So when a patient comes in, despite all the chaos, despite all the, varied interests that are happening at that time, everybody needs this or that or whatever, the standardization of that process is what's important. So you get the certificate on the wall, but the most important thing is the process that patient will fall into. So despite whatever's happening in the ER, you get the exact same care that's been standardized. It's fast, rapid, accurate, and standardized to be among the best in the world. And so I'm very confident with our local process. We're able to do, in terms of stroke, we're able to do rapid CTAs, and using artificial intelligence, we're able to tell if this patient had parts of their brain that are still salvageable. And if they do, we're able to fly them out to an interventional system, either in Tyler or Houston, that can take care of that. Very few systems are able to do that in rural communities and communities such as ours, but we have that here and we can take care of those patients. And it's best practice, right? So when my mom comes in or anybody's parents come in or whatever who's having a stroke, you can rest assured that they're getting the best practice, best level care that's available.
Thank you, Dr. Klingenberg, and thank you again for joining us for Ask a Nac Doc.